What do you make of Sajid Javid's statement? Was it necessary?
Well, it's certainly obvious that we need to do something so more people can see a GP face to face. I've always been very sceptical about what was Matt Hancock's policy of moving people to consultations with their doctor via Skype or via an app. And that was a pre-COVID policy. And this is what Matt Hancock wanted, that technology was going to resolve everything. All you needed was a Skype call. That will work for some people. I mean, I wouldn't personally, it would probably work for me. But we know that if you've got a lump or a bump, that going to see a GP for a direct face-to-face appointment is so much more important. And it's often in the conversations with GPs face-to-face that the GP finds out about other ailments which perhaps you didn't want to raise as soon as you walked in the door, but they come out through the conversation. So we need a system that allows people to see GPs more face-to-face. But of course, the problem is we don't have enough GPs. And actually, Sajid Javid promised in 2019, he was the Chancellor of the Exchequer then, he promised to recruit 6,000 extra GPs. David Cameron promised 5,000 extra GPs, but instead of delivering these extra GPs, these extra doctors, the numbers have actually gone down. And what's been announced today, when you look at the detail of it, it works out around £33,000 for every GP surgery. I mean, it's obviously better than nothing, but that's not going to recruit an extra locum doctor to increase radically the numbers of appointments available. So it looks to me like his announcement's actually unravelling as well.
He's talking about a league table to publish data on what different GPs offer in terms of those face-to-face appointments. There is massive variation. Some areas less than half of GP appointments are face-to-face, other areas 3/4 face-to-face. Now, does a GP shortage explain that?
Well, I mean, I'm not against more data. I think the more data you have in public services, the better. And we have a lot of data. I mean, we've had data today which shows nearly 6 million people on the waiting list, for example. That's a record. I mean, data is important. And I think if through clear data, if you can spot areas which seem to have more face-to-face appointments than others, that allows you to get a sense of the picture as to what is going on. But it's only one part of the picture, only one part of the jigsaw puzzle, because you do need to look at the numbers of GPs in an area. So, for example, it's often poorer areas, what have now become known as the red wall, this new term since the last general election, tends to be the red wall areas which are underdoctored, which have less GPs. So if you're going to produce the numbers around the face-to-face appointments, we should also have the numbers around the GPs available in areas. And the reason why often these poorer areas have less GPs is because the funding formula has changed slightly over the last 10 years. Under the last Labour government, we had a funding formula that incentivised GPs to go to poorer areas and so-called red wall areas. The Conservatives undid that element in the funding formula, so we end up levelling down general practice in the red wall and poorer areas.
John, we often say we haven't got enough GPs, and yet I've got kids of university age. I know many, many young people among their friends who wanted to be doctors, who wanted to get into medical school, and because they didn't have absolutely perfect grades, both at GCSE and A-level, they couldn't make it. No, everyone understands we need the best and the brightest to work in our medical service, but surely we should just expand the medical schools. There are so many young people out there who would make really, really good doctors, but because they weren't absolutely at the top of their class, they never got the chance.
I think this is an absolutely brilliant point, and you're spot on. And actually, when you look at it, the requirements to get into medical school are so tight. And I don't know your own personal circumstances, and it's not for me to know your personal circumstances. But when you look at it, disproportionately, it's actually it's those from private schools who are more likely to end up in medical schools because of the way in which the grading is so tightly drawn. We need to expand access. We need more training places, and we also need to make it more attractive to training to become a GP. If you want to be a GP, and the training at the moment, you spend a big amount of your time training in a hospital, but you don't actually want to be a doctor in a hospital. So why are you spending so long training in orthopaedics in hospital when you should be going directly to train in general practice. So we have definitely got to look at the way in which we train people, and we've got to make it better. So when I talk about those red wall areas, which have seen GP numbers fall over the last 10 years because of the way the funding formula has changed, let's widen access so more people from those areas can train to be a GP and go back to live in their areas and be a GP in Mansfield or Bolton or wherever it is.
What does the Shadow Health Secretary do to celebrate his birthday?
I come on GBNews to talk about the crisis in the National Health Service.
Tell your friends.